Okay. Okay, good morning everyone. How are you today? I hope you are always feeling good and well. And before we start, I hope that you stay for the rest of your life healthy and well. But if any of you had to go under the knife for any surgical operation, would you prefer to be operated on by a human surgeon or a robot? So, any volunteers who want to answer that question?
Maybe human.
So most of you want human surgeon to operate on. Okay, let's see that after this presentation. Okay, this is my presentation today. We will talk about the definition of surgical robotics and one version of the surgical robotics, which is the Da Vinci robotic surgical system, the benefits and the limitation of these surgical robotics. So, what are the surgical robotics? First, the definition, it's a tool used to perform endoscopic surgery. Endoscopic means inside the body, without opening the body. This kind of operation called MIS, minimally invasive surgery. It's called minimally invasive surgery because the surgeon does not have to open your body for large incisions like 6 inches or 12 inches incision. In MIS, the surgeon only works on small pores, 1 to 2 centimeter diameter, okay? They don't have to open your body for crack your chest or anything like that. They will just open a small pore here, and they will work and close it with small stitches, okay? So why they were developed in the first place? Surgical robotics were developed initially to allow the surgeon to remain in their cities, okay, and operate on soldiers while they are in the battlefield thousands of miles away. And another reason is that even the steadiest and the most skillful surgeon has minor vibration in their hand. So if they are working on operating on a patient, they still have some vibration, and this robotics will correct this shaking and allow more precision during the operation. Of course, all of this information is from interview with Dr. Johannes Bonatti, cardiac surgeon from University of Maryland. Okay. Now we will talk about this version of robotic surgical system. It's one of the most popular version, and actually I think it's the only commercial version of the robotic surgical system. Okay, this is the surgeon console. This is where the surgeon placed. His head is tilted like this, okay, and his hand on the master handle. When he moves this handle, the tools will operate and will cut or coagulate or close the wound of the patient. The patient sidecar. The patient sidecar is the one who has robotic arms, okay, which are directly in contact with the patient. It consists of 2 or 3 instrument arms and 1 endoscope arm. These are the instrument arms. The surgeon can use one of them to cut, can use the other one to connect to arteries or to veins or whatever. He can use the third one to coagulate. Coagulate means burning for stitching. And there is one more arm, endoscope arm. Endoscope means it's an arm with a camera inside the arm to move the picture or the image from the patient to the doctor on his console. Endurance instrument. Endurance instrument is the end of the arm. Here's the, let's go back again. That's the arm. At the end, this part called endurance instruments. Okay. The endurance instruments allow the robotics to simulate human movement, okay? This is actually does the part of a human hand, okay? And each instrument has its own function. These are examples for us, some of them to hold the skin. This one is for cutting. This one is for holding maybe thicker skin. It depends where the surgeon operates and which part of the body. Okay, the device memorizes the position of the robotic arm. This is one good advantage, that if you need to change the tip of the arm, the robotic system can memorize the original position, so when you use another tips, it will go back to the original position. And the main advantage is that this instrument has the ability to rotate in full circle. The human hand can only move at 180 degrees and go back at the same degree. This can rotate in 360 degrees, so it can be rotated in full circle which can allow more precision during the operation. The 3D vision system is this is the endoscope unit or the endoscope arm. It will move. It will show the view of the operation to the doctor, and it has advantage that it's really high resolution and at higher magnification. I mean, it's probably maybe 10 or 20 times more magnification power than the human side. And there is a video processor that eliminates the background noise. The background noise means if I am taking a picture or a video, a clip, there is some extra noise like air noise or any sound from other machines or sound from other people from the team. So this processor will eliminate this noise and it will show clear and real-time image for the surgeon. So this is a view for the whole system. This is where the surgeon is placed here on his console, maybe 5 or 3 feet away from the patient. These are the arms working on the patient. These are supporting team that will help to make the operation much more easier. Okay. The benefits of using robotic surgery. Okay. First, we said that you don't need to cut the body. You don't need to use large incision. So that means it's much more faster to recover for the patient, because he will not need more time for his tissue or his wounds to heal. So that's fast recovery, and also it's less pain. For the same reason, we only use small pores that it's less painful for the patient. No need to crack the chest. This is one of the hardest part in any open heart surgery, cracking the chest, using a chainsaw to crack the chest and rewire the chest again. Fewer complication, of course, because there is less wounds, less tissue cut, less tissue break. There will not be, the patient will not be at high risk for infection if we use only small pores rather than if you use large incisions. Okay, there is another benefit for the surgeon. The human surgeon, we said, he only can move his arm at this degree and go back. Okay, the robot can do a full circle, so it's one of the good advantages. And higher magnification power, it's 10 or 20 times more magnification power, so the doctor can see the small tissue, the small artery. It's better than using just my own side or the surgeon own side. Okay, remote operating. This can be comfortable for the surgeon if he operates in the other room or in 10 feet away from the patient. Limitation, the cost of the system is high. It's almost $1.5 to $3 million, so you can't find it in every hospital. It's only the really sophisticated and some hospitals, not all of the hospitals in the world. And there are some practical issues. Some surgeon need to feel the tissue in his hand so he can be comfortable and operate correctly. So the lack of tissue can be uncomfortable and can cause a problem for some surgeons. There is a large space needed because the system is really huge, so you need probably 1 or 2 rooms to store the system and to do maintenance on the system, clean the system, so you need really a large space. There is some technical issue. There is possibility of breakdown because it's a machine, it's not a human being. So there